Well, Stephanie, most of us hate it. It is the dreaded colonoscopy. Doctors say it's essential for detecting colon cancer. Millions have it done every year, but millions more should. Well, now there's a new non-invasive at-home test for colon cancer. Cologuard is FDA approved and Medicare covers it, but it is not cheap. Joining us now to talk about it is Dr. Devi. She is an assistant professor at New York University School of Medicine. So, Cologuard, how accurate is this test?
So if you look at whether it can detect cancers, it's about 90% or more accurate. So that's a good number, but it's not a perfect number. Now, we have to compare it to colonoscopies, which are our standard. So if you think about colon cancer, the main thing to remember is that colon cancer doesn't just appear out of nowhere. It takes about 10 years to develop, so it's considered like a preventable cancer. You have a cancer cell, then it grows in this polyp, and normally what you do is you get a colonoscopy. They see the polyp and then they remove it at the same time. That's why you get them done every 10 years. Now, Cologuard works a different way, so it actually looks in your stool when you go to the bathroom to see if there's any DNA or genetic material from a cancer, and it detects it that way, but it doesn't actually treat the cancer itself.
Is there a downside to this test?
Well, there are a couple downsides. So first, it doesn't actually treat the cancer if it finds one, so you'd still have to get a colonoscopy. The other thing is that, when we talk about precancerous lesions, so these are things that are not cancer yet but could lead to cancer, it's not as good at finding those. So colonoscopy is a little better in that sense. So it can be misleading because maybe you would benefit from a colonoscopy in removing these polyps, but the test doesn't actually find it.
So as we mentioned, most people hate getting the colonoscopy. So is this a suitable substitute for going to the doctor and getting that colonoscopy?
I wouldn't use the word substitute. I don't think it would be a great substitute, but at the same time, it can help a lot of people because, like you said, Del, a lot of people are very scared about getting a colonoscopy, right? So they completely miss out on the screening and then they develop cancer and, it kills so many people. But this test, if they get it done, maybe it will take them a step forward so they can know if they're higher risk or not. Now, the danger is if it's negative, if it says they don't have cancer, then they might avoid the colonoscopy altogether. Whereas even in that 10%, that accuracy for like over 90%, if they're in that 10% and they think they don't have cancer and they do, then we have a risk of losing them.
Let's talk about the possibility of human error. A person does this test, they do it in the privacy of their own bathroom, they then send it into the lab, which cuts out that middleman. But is there the possibility for human error in this test? False positives.
Of course. So that's the thing. You can get false positives. That seems to be less of an issue here, but you always wonder about that because it's looking for genetic material. So you could have genetic material from cancer, let's say, but your body's immune system fights it. Now, this happens all the time with any type of cancer. We actually get mutations every day from the sun, from just exposure, pollution, and other things. Not just colon cancer, but in general. But our immune system destroys those cancer cells. So it is a little bit difficult to tell sometimes if something, detects the cancer, whether you need to necessarily go forward and do different steps. But I think this is very exciting.
Now, what, if anything, makes this particular test better than the other tests that are out there in the market?
So there are a variety of different things that are trying to fill the gap for people who are afraid of colonoscopies. I mean, you have pill cameras and things where you swallow and look for cancers. I mean, those things still require a lot of the prep where you have to kind of clean out your bowel. And it's hard to compare this test to that because they don't really do head-to-head comparisons. A lot of the manufacturers, they're trying to get their test approved, so they don't necessarily want to compete with their competitors and do a head-to-head comparison. At the same time, because this is looking for DNA, it's a lot less invasive and it can be more sensitive. So that number, that accuracy number, is actually very high, which is a good thing.
So you are now free to continue eating breakfast. Dr. Devi from New York University, thanks for being with us this morning.